Hi there, patient. My name is Dylan. I'm a student physical therapist at UAMS, and today I've been sent to go check out your wound today. So basically what we're going to be doing is that we're going to be taking off your current dressing, assessing your wound, and putting on a new dressing. Some things to expect is that we're going to be shifting around just a little bit, placing some linens underneath you and overexposed areas. We're going to be taking off your dressing, cleaning your wound, assessing your wound, and then putting on a new dressing. Does that sound okay with you? Great. Do you currently have any pain right now? No? Okay, so I'll go ahead and get everything started. So, go ahead and clean off my table here. Now we'll go ahead and move my trash can over. I'll go ahead and wash my hands. I'm going to make sure that I wash my hands along with my forearms. Make sure that I get each individual finger as well, including my palms and the back of my hands. My forearms. Also get the fingernail beds. Right. About. Okay, so now I'm going to go ahead and set up my treatment table. So I'm going to place 2 towels here. Make sure that I get the entire tray table. And as I do this, I'm going to go ahead and designate a clean side and a dirty side. So this will be my clean side and this will be my dirty side. So I'll go here and put everything set up here. Okay. And then grab my spray bottle as well. Okay, so I'm going to go ahead and put on my PPE. So I'll first start off by putting on my mask. And I'll go ahead and put on my protective eyewear. Okay. And lastly, I'll go ahead and put on my gown. Okay. Okay. So I'll go ahead and Alright, so then I'll go ahead and put on my gloves. go ahead and drape the patient. So you can just assist me here. Place this underneath the patient. Okay, and we'll place another layer over the patient onto the exposed areas. Okay, so now it's ready to to take off the current dressing. So what I'll do is I'm going to make sure that I press on the skin as opposed to pulling on the tape. Okay, and I'm going to continue to do that. Make sure that I pull all the dressing off, that secondary dressing. Okay, go ahead and take off the primary dressing. Then I'll go ahead and assess the exudate. So I'll look at the type, the amount, and the odor. So based on my observation, I see a minimal serosanguinous exudate with no odor present. So I'll go ahead and dispose of this. Okay, now we're gonna go ahead and clean the wound. So clean it. I'm gonna go ahead starting from the inside, going out. So we wanna make sure we get the entire wound bed, make sure that we thoroughly clean it. This. Go ahead and get another one to really dry out the middle. We're gonna make sure that we also get the undermining and the tunneling that's also present. And then we're lastly going to just wipe down the outside edges, making sure that this doesn't touch the inside as well. Okay, great. All right, so now we're gonna go ahead and dispose of our gloves. So take off our gloves here. Leave that right there. And then we're gonna go ahead and set up our tape. Put on our new pair of gloves. Okay, and now we're going to go ahead and assess the wound. So nurse, I'll have you help me out here. I'm going to be taking some measurements. I just want you to record them for me, okay?
Okay.
Alrighty, so going from, using the clock method, going from 5:30 to 11 o'clock, the length of the wound is 11.9 centimeters. Perpendicular to that, from 7:30 to 1:30, the width is 10.4 centimeters. Go ahead and assess the depth. The deepest part is here. Go ahead and assess it. And our depth is 2.1 centimeters. And then at the site of undermining, which occurs from 10 o'clock to 2 o'clock, the depth of that is 2 centimeters. And our tunneling, which occurs from 7 to 7:30, has an apparent stop with a depth of 4 centimeters. So can you confirm that you got those measurements?
I have all those measurements.
Okay, so we're gonna dispose of that. All right, and now we're gonna look at the wound bed itself. So based off my observation, I see 60% beefy red granulation tissue, 30% yellow slough, 5% exposed bone, and 5% dry leather eschar. The wound edges are adhered to the body except for at the site of tunneling, which occurs from 7 to 7:30, they're unadhered. At the site of undermining from 10 to 2, which they are also unadhered. Everything else is adhered though. The peri wound looks dry and intact, and there's no signs of increased pressure or infection. present. It looks really good. Okay, but to make sure that they continue to look good, we're gonna go ahead and apply a peri-wound protectant. So we're gonna break that off and apply our peri-wound protectant around the wound. Okay, dispose of that. Alrighty, and now what we're gonna do is that we're going to finally pack the wound. So go ahead and pack the wound. Okay, and we're going to go ahead and get into both the undermining and the tunneling first. Let's make sure it's really packed in there. Okay, and lastly, one last layer just to make sure I cover everything. So it looks really good. So I'll go ahead and dispose of this. Okay, and now we're gonna go ahead and put on our secondary dressing, which is gonna be our ABD pad. This is gonna lay right on top of the wound. And then we're gonna cover that with some tape. Here. Make sure I get everything. Okay, and we'll do one more on here just to ensure that it's adhered to the body. Okay, so we'll go ahead and initial this. Put this now on our dirty side here. Okay, and now I'm gonna go ahead and take off the current draping that's on there. So patient, as I take this off, there's actually some points of education that I want to provide to you before we end things here. So I'll put this in the laundry. Okay, and so basically the peri wound, which is the outside of your wound, looks really good. So that means there's no signs of increased pressure. And we want to continue to do that. So we want to be a little more compliant with that. So what this means is that we're going to put you on a turning schedule. So for every 2 hours, we're going to turn you and provide pressure relief so that your wound does not get worse than it might be. And the way that we can do this is that we can have family help you. So if you have family in the lobby, we can educate them on making sure that you're on that turning schedule, and with the nursing and the hospital staff. So some things to look out for is for signs of fever. So signs of infection could be a fever could be a sign of infection, or if there's redness around the wound and the family member notices that, that can also be a sign of infection as well. So it's if that's the case, then you need to let the hospital staff know immediately. Any questions for me? Okay. Are you currently having any pain? No? Okay, so then we'll end things here then. Alrighty, so I'll go ahead and throw out anything contaminated stuff, and just based off my observation, there is nothing that I could throw out. And then I'll go ahead and take off my PPE. So I'll actually have the nurse untie this for me. I would typically pull this off, but okay, great, thank you. So I'll go ahead and take this off here. Okay, and then we're gonna go ahead and take off our disposable glasses. And then we're gonna take off our disposable mask as well. Okay, so I'm just gonna hand sanitize. As a hand sanitizer, gonna be prepared, ready to clean off the water bottle and the pen as well. Okay, so we'll go ahead and get the water bottle and the pen. So first, I'll get the water bottle. Everything down with the water bottle. this over here in the appropriate area. Dispose of that. And then we're gonna go ahead and clean off the pen as well. Okay. We're going to place the pen in our pocket here. As well. Okay, and now we're going to go ahead and hand sanitize one more time. We're going to put away any of the stuff that we can reuse. So I already put away the saline spray, but we can also put away the tape too. So since the tape was on the clean side, I can just grab it after I've hand sanitized. Place it here by the saline spray. Okay, and now we're going to go ahead and remove the tiling that I placed on here. We're going to go ahead and place it in the laundry. Dispose of that. And lastly, we're going to go ahead and wipe down this table. Okay, so we'll go ahead and dispose of this. And lastly, I'm going to go ahead and wash my hands one last time. So as I wash my hands, I'm going to go ahead and do the same process that I did last time. Make sure that I get my forearms, get the back of my hand, palms of my hands. I'll make sure I get every individual finger as well. And I'll also get the nail beds. Okay. Wipe this off. The rest of this soap here, my forearm. And then we will